Marquez here at Back Pain Relief Center. Today we are adjusting Dr. Staci Avakian. Even as chiropractors, we need to get adjusted. I guess we do about once or twice a week. We bend over all day. We put a tremendous amount of strain on our necks and backs, so we want to keep everything aligned. So first thing I'm going to do is we're just going to check her leg, because her leg length will give us an indication if her pelvic or lumbars are dysfunctioning. With her, it was a little bit on the right, so we're going to use a drop table just to realign that pelvis so it functions better, takes less pressure off the lumbar spine. Next, going to use an adjusting instrument we use on most of our patients. The way I use it is we go up and down the spine and we are breaking up scar tissue, reducing tone, allowing the joint to function normally. Makes our manual manipulation go just a little easier, so we don't have to use so much force. Next thing I'm going to use is a massager. I know it kind of looks like a buffing machine, but it is a massager, and what it does is just bring some blood to the surface, loosens the muscles a little to allow us to adjust easier, and reduces some tone. Next, we're going to do an upper thoracic adjustment, and this will be a manual manipulation. Again, realigning the vertebra, allowing them to function correctly. Deep breath, and out. Okay, next we're going to do a lower thoracic, upper lumbar adjustment. We're going to bend your legs. Okay, deep breath, and out. Okay, back down. We're going to do a cervical adjustment now, and with a lot of my patients, I do it while they're laying down. It holds a little longer. It brings that curve in the neck a little better. Not all of my patients like getting adjusted, their neck adjusted. About half of them do, half don't. There's a lot of other ways we can realign your neck without adjusting, but with Dr. Avakian, we're going to adjust it. That's it. All right, guys, there you go. That's a spinal manipulation for Dr. Staci Avakian.